a quite a bit of extensive agenda for today. Um, I guess we should call the roll. Hurt is here. Glover,
He's here.
Porterfield,
Present.
Pulley.
Here.
Thank you. That gives us a quorum. Now I have a motion of pursuant to the governor's leads executive orders number 16 regarding electronic meetings as extended by executive order number 34. I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council, and that meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of the COVID-19 outbreak. Is there a second?
Second, Madam.
So moved.
Thank you very much. Our first resolution is Resolution 2023-59, Mendez. It's adopting a new pay plan for employees of the Metro Board of Health effective July 1, 2020. We do have guests on the call, and I know that I saw Mr. Tom Sharp and Julie Tackett as our guests. Are any other guests that want to be recognized? There being none, Mr. Sharp, do you want to say anything regarding this resolution?
Mr. Sharp is not able to get in, and he just texted and said it conforms with Metro's plan.
Okay. Thank you. Thank you very much. Could I get, I'm sorry, I didn't get a motion for the resolution.
So moved.
Is there a second?
Second.
Any discussion? All in favor?
Aye.
Okay, any opposed? Thank you. Resolution 2023-61, Mendez and Hurt. This is a repeal for a period of 1 year, the payment of longevity pay for employees of the Metro government, including employees of the Metro Board of Health, and the payment of longevity pay supplement for certain employees. There's a motion.
So moved.
Is there a second?
Second.
Thank you. This basically is, you know, the climate that we have in our budget right now. We're just asking for there to be a delay in making those payments for employees. Is there any more discussion? All in favor?
Hold on, Mr. Glover has something.
Okay.
Go ahead.
Madam Chair, I will not support this because our employees have far too long, taking everything on the back here in Nashville. And I voted against it last night, Budget Finance. I'm going to vote against it tonight. I mean, I understand what we have to do, et cetera. But at some point, we have to wake up and get our priorities in line. So, Madam Chair, thank you for allowing me to speak.
You're quite welcome. Any other discussion?
I would like to be recognized, Madam Chair.
Yes, please, Councilmember Porterfield.
I agree with Councilman Glover. I think that it's important that we, take care of our employees, which is why it's also important that we make sure that we're honoring our commitments to them. The rationale behind not furloughing our employees so that government could continue. I think it's an important conversation, and I agree with his statement. So I will also be a no vote.
Okay, thank you very much, Councilmember Porterfield. I would just like to add that I know in Budget and Finance last night, Councilman Glover mentioned that none of the Metro employees were furloughed, and none of the Metro employees basically have been affected by the restraints and constraints that we have on our budget. And I think that it's unfair to those who are outside who have to lay off people, have to furlough people, have to actually terminate people as a result. It's not that they aren't going to get paid, but it's just that it's not going to be paid at the time that they thought they were going to get it. So With that, I am going to stand in favor of this resolution, and I ask for other votes at this time.
Madam Chair,
Yes.
Mr. Glover has something else I think he wanted to mention. Go ahead, Steve.
Okay.
Actually, Madam Chair, I believe you spoke eloquently and you summarized my thoughts. So thank you so very much for summarizing my thoughts on that, because you're right. The government has not felt the same pain we've inflicted on others. So thank you so very much.
Thank you. So I'm calling for the vote on this resolution 2026-361. Councilman Pulley?
I just was going to vote in favor of it.
Okay, and Councilman Glover, you still a no?
No.
And Councilwoman Porterfield, you still a no?
I'm a no, thank you.
Okay, so it's 2 and 2. Thank you very much. Resolution 2020-369, Mendez, Hurt, and Welsh accepts a grant from the Greater Nashville Regional Council to the Metro Social Services Commission to provide meals that meet RDA nutritional guidelines to eligible seniors. Is there a motion?
So moved.
Second?
Second.
Thank you very much. I do know that Director Crum was on the line at one time. This is a recurring grant that they received, and I know it's one of those Meals on Wheels to providing for our children who have lunches, breakfasts, and different things of that nature. Director Crum, is there anything you'd like to add to this resolution?
No, Council member, just want to remind you that this is social services and not Metro Action. So that would be Director Renee Pratt.
Oh, that's right, Renee Pratt, and this is what Carol Wilson does, but this is still serving the community with the Meals on Wheels program. I apologize for that. But I know that Councilmember Pulley and those of you who have been on this committee for a few years realize this is a recurring something that we've done each year. Is there any other discussion in regards to it?
Only that it's great to hear from Dr. Crum again.
Well, things happen for a reason, so thank you, Councilman Pulley. All in favor, say aye, please.
Aye.
Councilman Glover?
He said aye.
And Councilman Lady Porterfield?
Aye.
Thank you very much, and I'm an aye as well. Resolution 2020-371, Mendez, Hurt, and Welsh. This is also a grant. This amendment to a grant from Greater Nashville Regional Council to provide nutrition, home, and community-based services to eligible seniors throughout Davidson County. So this is also the Meals on Wheels program, and this is Amendment 2. Is there a motion?
So moved.
Second?
Second.
Any discussion? There being none, all in favor?
Aye.
Aye.
Thank you very much. The next resolution is Resolution 2020-372, Mendez, Hurt, and others. Accepts a Healthy Start Initiative, eliminating racial and ethnic disparities grant from the United States Department of Health and Human Services to the Metro Board of Health to provide a variety of services in reducing infant mortality for pregnant and parenting women. May I have a motion?
So moved.
Is there a second?
Second.
This is also another one of those recurring grants that we are receiving for the infant mortality program. I know that we've been able to reduce the numbers. It's still not where we want it to be, but with this grant, it gets us moving continuously in the right direction to reduce it and eventually eliminate. Is there any more discussion? There being none, all in favor say aye, please.
Aye.
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 Thank you very much. So there's 4 in favor and 0 against. Next resolution is Resolution 2020-373, Mendez, Hurd, and Welsh accepts a grant from the Tennessee Department of Health to the Metro Board of Health to build local capacity to improve public health response to the substance misuse epidemic in the Middle Tennessee high impact area. May I have a motion?
So move.
There's a second?
Second.
Thank you. It's been properly moved and seconded. Again, another recurring grant that we received in order to help with our substance abuse problem that we have in Middle Tennessee. And any more discussion?
Mr. Sharp just wants to make sure that we know this is the opioid response grant.
Right. Any other discussion regarding this? All in favor, say aye.
Aye.
Now, because I do run an organization that receives funds for it, well, we don't receive funds for this particular program, but I'm good for this one. So there's 4 in favor and 0 against. The next resolution is 2020-374, Mendez, Hurd, and Welsh accepts a grant from the Tennessee Department of Health to Metro Board of Health to achieve sustained tuberculosis control and enhance tuberculosis prevention to eventually eliminate tuberculosis as a public health threat in Tennessee. Is there a motion?
So move.
Second.
It's been properly moved and seconded. Again, we are looking to eliminate tuberculosis. This is a grant that we've had for some time, and just approving for it to continue the good work that we have at our health department. Any more discussion?
And Mr. Sharp says this is a standard TB grant from the Tennessee Department of Health. That's all he's got to add.
Right. Thank you very much, Mr. Sharp. All in favor, say aye.
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 Again, we have 4 in favor and 0 against. Resolution 2020-375, Mendez, Hurd, and others accepts a grant from the U.S. Department of Health and Human Services to the Metro Board of Health to prepare, prevent, and respond to COVID-19 as needs evolve for clients of Brian White, HIV, AIDS program recipients. Is there a motion?
So move.
Second.
It's been properly moved and seconded. This is one of those grants that has been received for years to address the Ryan White, but they made an extension to that grant to address the COVID-19. As we know, COVID-19 affects those with underlying conditions, and HIV and AIDS is definitely one of those conditions. So they provided additional funding to support those clients who may be living with the disease in one of those underlying conditions. Is there any more discussion regarding it?
Mr. Sharp just says it's just as written, nothing more to add from him.
Okay, and this is one that I would need to abstain from, but for the other 3 members, are you all in favor?
Yes. Aye.
Aye.
Thank you very much. We have 3 in favor and 1 abstention to Resolution 2020-375. Resolution 2020-376, Mendez, Hurd, and others accepts a grant and approves Amendment 1 to the grant from the United States Department of Health and Human Services to Metro Board of Health to enhance access to a comprehensive continuum of high-quality, community-based care for low-income individuals and families with HIV disease. This, again, is one of those grants that we received for some time for the care of HIV and AIDS individuals. I will need to abstain from this, but is there any more discussion about this particular grant?
According to Mr. Sharp, it's just your standard HIV grants.
No more discussion, then all in favor?
Aye.
Aye.
Thank you very much. None in opposition?
Councilmember Hurd,
Yes.
I think that 369 might have been skipped over. If you could check that one.
I think that's right. I think we can skip over that.
Okay, well, we can go back to resolution. Thank you very much. We got a unanimous vote on the other, except for I had to abstain from that. Did you get that, Mr. Cooper?
Yes, ma'am.
Okay, great. Thank you. So going back to resolution 2023-69, I thought I called this SEPSA grant from Greater Nashville Regional Council to Metro Social Services Commission to provide meals that meet RDA nutritional guidelines to eligible seniors.
So moved.
Second.
This is a grant that we received, a standard grant that we received from year to year in order to provide those nutritional services for our seniors. That comes through the Greater Nashville Regional Council. Any more discussion? All in favor, say aye.
Aye.
Thank you. It's unanimous. I appreciate that. Now, taking us back to resolution RS 2023-77 approves amendment. It's sponsored by Mendez, Hurd, and Welsh. Approves amendment 1 to a grant from the Tennessee Department of Health to the Metro Board of Health to promote the proper use of all recommended vaccines and respond to vaccine preventable diseases in collaboration with the CDC and other partners.
Move.
Second.
This is another standard grant from Tennessee Department of Health for vaccinations for any preventable diseases that we have. Any more
And of course,
discussion?
Mr. Sharp says this is another renewal.
Right. Okay. Any more discussion? All in favor, say aye.
Aye.
Any
Aye.
opposed? There being none, we carry it one unanimously. Resolution 2023-78, Mendez, Hurd, and others approves Amendment 1 to a grant from the U.S. Environmental Protection Agency to the Metro Board of Health for the ongoing collection of data on ambient air concentrations for fine particulate matter in Nashville, Tennessee. Is there a motion?
Move.
It's been properly moved and seconded. Any discussion?
Madam Chair, I just have one question, if I may.
Yes.
I have to leave Hermitage and get to downtown to be there for the council meeting tonight. May I inquire how much longer do we think this meeting will go? Because
In about 3 minutes, we only have 2 more resolutions to act on.
thank you, Madam Chair. I'm sorry to interrupt you.
No problem.
Yes, thank you, Madam Chair.
No problem. Any discussion on the EPA grant for ambient air concentrations?
Again, standard renewal of the air grant.
Thank you very much, Mr. Sharp. All in favor, say aye.
Aye.
Aye. It's been approved unanimously. Bills on second reading: Rosenberg, Hurd, and Bradford. Bill 2020-301 amends the Metro Code to prohibit smoking on playgrounds owned by Metro government. So that bill speaks for itself. We have too many people.
Moved.
Second.
Thank you. It's been properly moved and seconded. It speaks for itself. Any more discussion on the bill?
Now, why in the world would you want to prohibit smoking on playgrounds?
Well, I think we have kids that are on playgrounds and we do not want to promote any smoking for those children. You know, they are our future and we need them around. So we are passing a bill to encourage them to refrain from even trying a cigarette.
No, I agree 100%. I firmly support this bill. Go ahead, Councilman Glover. I'm sorry, I didn't mean to interrupt you.
No, you didn't. Madam Chair, you know, he's just messing with me right now. I said I got to get downtown for Hermitage. And yeah,
Thank you. All in favor, say aye.
Aye.
Aye. Thank you. Any opposed? There being none, we have this last bill on third reading. This is a bill 2020-295 by Mendez and Hurt. This amends the Metro Code by abolishing the Nashville Career Advancement Center and moving the functions of that agency to the Metro Action Commission effective July 1, 2020. Is there a motion?
Motion.
Second.
Thank you. It's been properly moved and seconded. Dr. Kroon, you are with us and live and live in color. We will now have you speak on this if you like.
Thank you, Council Member. I'll just take any questions that you all have, and thank you so much, Councilman Foley. It's also great to both hear and see you.
Likewise.
Dr. Kroon is being very modest and just taking on questions, but I can tell you that Metro Action Commission is doing a marvelous job, very capable of taking care of any job training, skills training, soft skills, hard skills, whatever it is, they have a way of making it easy for people to learn, and they go above and beyond the call of duty in order to serve the community. And I am very happy to see them take over NCAC. And for those who may be concerned about NCAC and them losing jobs, many of as Dr. Kroon said in our last meeting, most of them have been repurposed and placed in other positions, or they have retired, and we have some who are working with the state and doing other things, but there's not been any displacement with this move. It's just been a means of streamlining and maximizing what it is that we have and minimizing the cost that has been associated with it. Are there any questions for Dr. Kroon?
Nice.
Madam Chair, I don't have a question. May I make this statement, please?
Absolutely.
Thank you, Madam Chair. When I first got elected on the council, I was on health and hospitals, and I got appointed to the MAC board. And I went to every meeting. I may have missed one, and if I did, I apologize for that. And never had an appreciation for everything they do and everything that they are and what they represent for our city. And let me just say this, and because I was there, I attended the board meetings. I listened to people and I heard what they were saying and everything else. And I got to tell you, everything they represent to be, they have done. When the tornado came through the Donaldson Hermitage area, excuse me, Madam Chair, I'm sorry, and throughout the community, no matter what, they have been a rock and a solid foundation. And I got to tell you, a lot of folks think, here's this conservative guy, this and that. But, every time I've reached out, asked them to help somebody, they've never failed. And so therefore, I have to applaud them on the work they do and say thank you. And I mean that with all of my heart. Thank you, Madam Chair.
Thank you, Councilman Glover. We appreciate that, and I think we all can agree with you. Council Lady Porterfield.
Thank you so much, Madam Chair. Dr. Kroon, I know you addressed it at the previous meeting before the sake of a new committee meeting. Can you explain I'm hearing that there are layoffs with this merger, and I know you guys are saying that there are not layoffs. Can you just clarify that, please?
I think probably, thank you, Council Member. I think probably what people are referring to is that not all positions are actually being absorbed by our agency. We're absorbing, I think, 7, maybe 8 of those positions. Some of them are going into existing grant positions that we already have. So with the exception of the executive director and one other individual, everyone else has either been placed or have retired. The 2 individuals that have not been placed at this time, one has a possible opportunity with water, and that same person also may come to Metro Action Commission as a part of additional grant dollars that we are anticipating. That leaves the executive director of NCAP, and the Metro Human Resources is working with that individual. I hope that answers your question.
It does. Thank you.
Thank you for that.
Thank you, Councilor Porterfield, for your question. Are there any additional questions for Dr. Kroon? Thank you all very much for your patience, and we apologize for the delay in starting our meeting, but that was the last of our agenda, and I thank you all so much. This is
Councilwoman.
Yes.
Pardon me, Councilwoman Hurt, we haven't voted on it.
Oh, I'm sorry. All in favor?
Aye.
Any opposed?
I would like to be recorded. I would like to be recorded as an abstention, please.
Okay, thank you very much.
Thank you.
Thank you. That concludes the meeting of the Health, Hospitals, and Social Services Committee, and I bid you all a good evening.